Hello, everybody. I'm going to talk about systemic treatment for breast cancer. Dr. Lazarus will talk about the surgery part, and I'm going to talk about the chemo and targeted agents part. The take-home message from this slide is going to be part of the take-home message, is that before the 1960s, really there wasn't a lot that was offered for systemic therapy for breast cancer. 3 genetically expressed markers are commonly used to treat breast cancer: the estrogen receptor, progesterone receptor, and the HER2 receptor. What's been a field of a lot of excitement lately is mapping out the genetic complexities of breast tumors. The goal of breast cancer treatment moving forward is to target as many of these genes as we can with as smart of drugs as possible to avoid the toxicities of chemotherapy.
So I'm going to talk a little bit about the surgical treatment of breast cancer and some of the, more recent developments in cancer. And just like Stacy talked about, some of the ways in which we're trying to deliver more targeted therapy to patients and more individualized treatment, looking as opposed to 20 years ago where we looked at the size of the tumor and if lymph nodes were involved. Today, we want to look at more specific features of your cancer to determine, do you really need to have this treatment? And we've developed better ways at identifying that and better tests to find the specific targets. With surgery, we're looking to do less surgery as well. We are able to save a large portion of the skin in the breast in selected patients, and that we can more individually look at the tumor, where it's located. If we are doing a mastectomy, what skin we have to remove so that we can get margins around the tumor for the cosmetic finding results of the surgery that we're doing. And it allowed us to better able to reconstruct the breast at the time of the initial mastectomy in many patients. A lot of times we will, in the United States, work with plastic surgeons if a tumor is going to change a little bit of the size of your breast, or if you have a larger breast and had been considering a breast reduction, we can combine the surgeries into something we call an oncoplastic approach to the cancer, removing the cancer and allowing you to have that better cosmetic outcome from it.